This is Recovery After Stroke with Bill Gassiamis, helping you go from where you are to where you'd rather be.
Well, Tracy, welcome to the program. Thank you so much for making the time to have a chat with me.
You're most welcome. Looking forward to it.
The reason I got in touch with you is because, part of what I like to do is put out good information, stories and experiences about stroke. And I got into that because I had, my own experience with stroke, 3 brain hemorrhages and brain surgery and rehabilitation. And I struggled with most of the things that stroke patients relate to and say that they suffer from, but on a very minor scale. And the really interesting thing about that for me is because I experienced stroke in a form which is mild compared to others, although it's been very challenging, I often found myself wondering what it was going to be like for other people who are doing it a lot harder and a lot tougher. So that was the background for why I began, this sharing journey of mine. It helps me heal, etc. And one of the most important things to me, though, was that I was able to talk and communicate my stroke experience, and my sharing occurred through talking, interviews, and all that type of stuff. And what I never had a loss in my ability to communicate by voice. And it's something that I reflect on, and I'm grateful that I didn't have, but I know that other people suffer. And when they're early on in the process, I'm concerned that they may be doing it a little bit harder than they need to be, in that they're very over anxious or over concerned about what they've lost. And what I want to share is the other side of the story, which is, with work, we can get things back. So that is why I reached out to you. So thank you so much for, giving me the opportunity to share this part of your story. Can you tell me just a little bit about what it is that you do?
Yes. It is such a frustrating thing when communication is affected. And I guess that's really what my career is dedicated to, helping people with communication difficulties. So communication difficulties can be caused by a whole range of problems like stroke, and some people are born with other neurological issues like cerebral palsy, which affects speech too. But what these all have in common is they are originating from the brain and the central nervous system. So what what speech pathologists do in general is usually come in after the event at various points and offer therapy or a treatment program, rehabilitation, and alternative strategies as well, so that communication is assisted and facilitated as much as possible, because we know it's such a frustration for people when communication is affected, and it can impact on so many different parts of your lives, starting right down, with personal relationships, right through to being able to read a prescription on a tablet bottle or sign your name. So communication can be affect a whole range of aspects of your life, and the aim is to try and assist people to have functional communication and then improve their communication skills.
Yeah, what's interesting, when I read your bio, I took a couple of words out of the bio that really sort of struck out at me, and one of them was communication disability. And I never considered it. Just, I don't know why, a disability that somebody can't communicate, but I kind of get how it could be, right?
Absolutely. It's an interesting term, and it's not one I use commonly. In fact, I was at a professional event and somebody said that they didn't work in the area of communication disability, and I hadn't thought about it using that term either. But it covers a broad range of ways that communication can be impacted, and it is Yeah, it can certainly be, depending on the severity, varying levels of disability, the impact on your day-to-day life.
Yeah. One of the previous episodes of the podcast is a lady called Clodagh Dunlop, and she experienced locked-in syndrome after her experience with stroke. And
gosh.
yeah, pretty heavy stuff. And one of the things that she had to get back was her ability to speak. And only now today, and since that episode, I've just placed the pieces together about how it could be a disability for Clodagh, because she was in a position where she was fully aware, completely coherent, unable to move any part of her body except blink, and actually couldn't also speak to say I'm too hot, etc. And that really just, to me, is one of those things where, well, you don't really realize what you got till it's gone, but also how much of a disability speaking or not being able to speak is, because she not only had all the other disabilities, well, she also had the inability to communicate and say, I'm too hot, or I'm too cold, or I need something, or etc. So I love that there's people like you doing the kind of work that we're going to talk about that you do.
Yes, well, in fact, that scenario is exactly up my alley, because I have really specialised down through a number of, there's the wider area of communication difficulties, and then something more profound, and right down to the disability area. And somebody like the lady you just mentioned, who has the communication difficulty, but also a physical disability as well. And that's exactly the area I work in right now, which is with assistive technology and alternative and augmentative communication strategies. But they're really compensatory techniques, and very useful, because it means people can have functional communication restored again, or in some different or alternative format. There's a lot of other variations in between. So that's kind of the extreme end, I suppose. But it is great to know there's certainly a lot of great technology around to help people who only can maybe blink their eyes. But a lot of other people have, as you were saying in your own case, a very, more mild impact from the stroke.
Yeah, let's talk a little bit about alternative augmentative communication. What is it? Can you describe it for us and give us a couple of examples?
Exactly. So the acronym is AAC, Alternative and Augmentative Communication. And I know we always tend to get into jargon, but it's kind of meaningful. So alternative communication or augmentative communication. So alternative means an alternative way of communicating. So mostly we use in our daily life speech and body language and some gesture for our day-to-day face-to-face communication. If we're looking at an alternative form of communication, we might be, we probably all use maybe writing sometimes, or we might type an email. They are alternative forms of communication, but there's also some alternative forms of communication, such as pointing to letters on a letterboard, or using a communication device where you can type out your message and it speaks out for you. So they're really alternative forms of communication. You might have difficulty after a stroke actually spelling, and so a letterboard might be too complex, and you might prefer to have photographs or pictographs, some kind of symbols to point to, instead of having to worry about trying to spell a word that might be just too tricky for you at that time. So we can have symbol boards, and really they need to be designed according to the person's, where they're at with their recovery and just whatever is functional for them. Then the augmentative side of it. So what happens is people don't generally lose all of their skills. So you might have a little bit of speech, or you might still be able to use your gesture and point to things. So we might augment those residual skills following something like a stroke. So you might have a bit of gesture, and so it might be a strategy to teach some more formal signs or a bigger range of gestures. So we're augmenting some skills that you already have. So that would be an example why we say alternative and augmentative, because often people do have some skills that we can build on, and very few people have, need only an alternative form of communication. Often we can have a whole combination of strategies, a whole toolkit.
Yeah, awesome. Well, I'm curious to know how to give some guidance to people who might be listening, whose family members are going through this now. How do we? What needs to happen to access this type of support tools, for example? Is it something that happens automatically, or how do we start the process of trying to get our loved ones these alternative methods of communication?
Yeah, that's a great question, because it is, sometimes a bit of a specialist field, and not everybody that the clinical team that you're working with may not always be aware of all the options. So, and families might want to explore them themselves. So I guess there's two different pathways that might happen after a stroke. You might have your therapy, and you might be using picture resources and different exercises, and that's your sort of therapy pathway where you're practicing something and trying to improve the skills that have been affected. And then the other pathway is having a way to communicate all the time, using the skills that you have right now. And that's where we like to come in with alternative and augmentative communication strategies. And that's why I like it very much, and what drew me to the field, because it's so practical, and you're really looking at the person right now. You've walked in the door. What skills do you have, and how can we maximise those skills and give you some tools and strategies that you can use right now today so you can continue to communicate? So at the extreme level of being affected by the stroke, the lady you mentioned who was basically locked in and could only blink her eyes, well, she can blink her eyes. So we can find a way for her to control a device, a computer, that involves blinking her eyes to make a switch, to activate a switch, and to make a selection of a letter or a symbol or a word. So that would be at that level. Whatever skill she has, we would start there. If it's a family member at home, and often, with not such extreme impact of the stroke, maybe the person is, depends really what type of communication problem they have, because there are several different ways communication can be impacted. I don't know if you've been through this before on any of your other podcasts with the types of communication problems, which are aphasia. You haven't done that?
I haven't done that yet. So tell us a little bit about those. I know a bit about aphasia, and it's one of the more commonly spoken about challenges. So tell us a bit about it.
Yeah, so basically, because when you've had a stroke, the brain is being affected. So various aspects of the brain's functioning are going to be impacted. And for communication, there's really three main ways communication can be impacted. So aphasia is like a central language processing. Something's gone a bit wrong with the pathways for centrally processing the language. So that means people can't say the words they want to say. They can't find the words often, or they get really stuck. So that's because it's coming from the central language processing, can't find the words that they want. They might have very little language at all, very little verbal expression because of that. It also affects understanding, so they can't process the words that are coming in. They can't necessarily understand varying complexities. They might be able to understand simple phrases and sentences, but not the really complex things. There can be a whole range in between. Then that also affects reading and writing, because obviously when you're reading and writing, you're processing that language in your head to start with, and then you've got to transfer it to the written word or your reading. So that's the sort of central language processing. You're smiling. Does that ring a bell for you somehow?
Yeah, I'm glad that you realised that it rings a bell and I wasn't laughing at people's difficulties.
No, of course not.
Yeah,
no,
so sitting after the second episode that I experienced, there was quite a lot of information that was missed, that was lost. Ability to speak, to hear, to communicate, to type an email. I vaguely recall sitting to type an email, which was going to be a couple of lines, and it should only take moments to take, half a day.
Yeah.
And in that half a day, the whole processing is not happening. It's kind of like, okay, what's the next word I want to choose? And then by the time I remembered the word, I'd forgotten what I wanted to say.
There you go. And
so,
that's exactly the processing. It becomes very tricky. So it's interesting. You've experienced that, and it becomes quite effortful, I imagine.
And really draining, and a lot of energy, and very difficult to get the brain to do the next thing that you want it to do, because you're completely exhausted at a brain, level. And the reason why, and I only experienced that for a few months, and then by the time, got time to have my neuropsych assessment, I had improved because the swelling had decreased and all the things that needed to happen started to happen, right? And then it just came online automatically. But I realized that a lot of people won't understand that as healing occurs, things come back. So practicing also supports those things coming back a little better. Now, I know that so some of the challenges that occur for speech are created by what we've already discussed, but is it true and is it correct that other people experience speech loss because of being intubated for quite a period of time, where they've had tubes in their throat for quite a while?
Yes, and that can happen. And I must say that would be more of an acute scenario, and it's probably not something I've had a great deal of experience there with. But I am aware that can happen. There's some other things too. So that aphasia is. So what you're talking about is more like a voice weakness, maybe.
Yeah, vocal cord issues and.
And that can happen as well, not necessarily just because of the intubation. So aphasia is sort of the central language processing, causing a breakdown in retrieving words and understanding and expressing words. And then there's other things that can happen with, so there's dysarthria, which is a different type of problem. So this is where people might end up not being able to speak very clearly at all, and might have like a real slurring of their speech, and they can't make the sounds very clearly, and their articulation is really, they really struggle to make the sounds because the neural pathways to the muscles have been affected. So whereas they used to, be able to go p and put their lips together and make a clear plosive sound, they can't do that anymore because the pathways have been affected. They know exactly what they want to say, so they haven't got that central language processing issue going on. It's just now they can't make the words they want to say, which can be even, extra frustrating. Then there's dyspraxia, which is a different kind of nerve processing issue again, where there's a coordination problem. So the actual muscles around the mouth and the tongue and so on might work okay, but the messages being sent down to them mean that they can't coordinate correctly. So there's a few different ways the nervous system is affected by the stroke depending on where the injury occurs in the brain. And then some people might have a little bit of each or combinations of each of those. So when we're looking at, so definitely there's different types of therapy to help, and that would be different according to which is predominant in those kind of problems. But in terms of introducing an AAC method, that will vary as well, because if somebody doesn't have so much of the aphasia, so they actually know what they want to say and maybe their spelling skills are all quite preserved, they may be able to quite quickly use alternative strategies and be able to write or spell alternative, as an alternative to their speech. The tricky thing there is the stroke happens in the left side of the brain, so often people end up having a right-sided hemiplegia, and if you're right-hand dominant, sometimes it can be really difficult to write legibly. But sometimes people might be able to, use an iPad or a touch screen or something, and there are some very simple. There's quite a range of apps actually that are in the AAC category, so that's kind of a nice alternative and an option for people. It's a bit of an inconvenience. You've got to carry around a device. Sometimes they have speech output, but it might not be loud enough when you're at the supermarket or something where there's background noise. But it's kind of a very socially acceptable thing too. This is something that's changed in our field with the iPad, that everybody's got one kind of thing, and it's quite an acceptable thing. Even if you have very good fine motor and very good vision, you might be able to, say, use a smartphone with one of these apps on it as well. And I have seen people just using even just like the text messaging or the notes section on their phone. And that's really what alternative and augmentative communication is, and that would be using something that's fairly mainstream, a consumer device.
Yeah.
But if you can't spell, because you do have the aphasia impacting, and a lot of people do have difficulty spelling, they might even lose their spelling skills altogether with a stroke. So then you might have a similar thing, but it might have the pictures or symbols to, just choose a single word, or that would be one of the ways to use an alternative device.
That's excellent to know. So how about assessment? How does somebody get assessed? Because if they wake up and then they can't speak, well, you guys have got a tough job. How do you work out whether it's aphasia, dyspraxia, or whatever? Like, how do you do that?
Yeah, there are tests. So that would be definitely the speech pathologist's role to carry out those kind of assessments. And so there might be tests to see what you can understand, and that would start maybe at a word level. Can you understand single words? Can you understand short phrases? Put the cup on the table, or, just simple phrases. So, that's got a few parts to it, and that's a bit more complex than just a single word, and then right through to a sentence level. So seeing what people can actually understand would be one test, and then seeing how, like, there's tests of naming things, like how is your word retrieval, your word finding? Can you name things? Can you explain things, pictures, and tell me what's happening in the picture? What's your expressive language like? And then that can go right through to a fairly complex level, because sometimes somebody might be able to do all of those things very well, but it might be just the very nuanced things like sarcastic jokes or some of those more complex fairly high level kind of comprehension, there might only be some kind of impact at that level. So the tests can go right through to that level to see, has there been some impact, and how severe is it? At what level are we at? So that would be the speech pathologist's role, and definitely to get all of that understanding of expression, understanding, reading and writing. Voice might be affected, as you were mentioning, with people who are intubated, but voice might also be affected just because, again, of the neural pathways. And so some people might have no voice left or just a very quiet whisper. Some people might have swallowing that's affected as well, and a speech pathologist would deal with swallowing issues as well. So all of those things would come into the assessment, and that's very much, that would be pretty standard for assessment for therapy. What may or may not happen, depending at that point, is whether people, as the patient at that particular point, are introduced to the alternative and augmentative communication methods. So you mentioned a bit about the timeline for recovery, and sometimes there can be a lot of recovery in the first few months. So you might start off on a pathway towards some AAC method, and then next week you might not need it because you've improved sufficiently. So sometimes the AAC methods, might be introduced quite early, and it might be just whatever is spontaneous. If somebody's pointing and using a lot of gesture, well, you say, well, we'll go with that. Or if somebody's really liking, benefiting from looking at family photographs or pictures and needing a cue to help prompt them, well, then we'll go with that. So it's not really like a formal system at that point. It's more what works at the time. And then as time goes on, often so recovery can happen for a really long time, up to years, but we always want to be making sure we're maximising the communication strategies at every point. So it might become clearer as time goes on. Actually, it would be really useful to have a communication board or some kind of alternative, a picture dictionary or something, and it might just be used as a repair strategy. It might not be, this is where the augmentative comes in. It might not be that you need it all the time. It might be just, right now, this time, I'm a bit stressed out trying to get this message out and I can't think of the word that I want, so I need my picture dictionary, so I'll have a look. Or I'm trying to say this word and I'm not being understood, so now I'll go and find my picture dictionary or or try and write this word or gesture it as a repair strategy.
Yeah, that's really fascinating. I was curious. I just picked up there in some of the terminology that you've used. We've spoken about speech therapist and speech pathologist. What's the difference between one and the other?
Yeah, good point. There isn't any difference. It's really just a change in terminology over the years. So in UK, they still they say speech language therapist. In Australia, we were speech therapists many years ago. Then it changed to speech pathologist. In Queensland, they say speech language pathologist. I think there's just, I think we have a bit of an identity crisis, because I think there was a thing about people thinking of speech pathologists or speech therapists as like elocution teachers or something, this sort of thing.
Finishing school type.
Yeah, there's a bit of that. And so there was kind of a lot of discussion about, well, what is an appropriate term that really encapsulates what we do? And it still doesn't really encapsulate it very well, because speech pathologists do deal with swallowing issues. And in terms of the area that I work in, the alternative and augmentative communication, so often people will ring up and talk about, how do we get hold of this equipment and how do we find out about it? And and we say, well, you work with your speech pathologist to find the most appropriate equipment, and often the reaction is, yes, but the person can't talk, and so why would they need a speech pathologist? So yeah, it's hard to find something like a communication pathologist might be a better term, but then that term's been pretty much hijacked now by the whole technology industry, and we talk about communication, so much more broadly now that, with our internet and so on is all about communication now. So it's the same meaning, really.
Yeah, fair enough. How do we go about getting family members to calm down, to be okay, and to be able to allow, their loved one to go through the process? Basically, what I'm saying is a lot of my challenge when I was recovering from stroke was actually managing everyone else.
Yep.
So I was 3 years in before I needed to actually learn how to walk again, because it was surgery that caused my deficits. That are long lasting. So it was kind of like I was very ready for whatever came, because I figured that learning how to walk again was going to be better than having bleeds in the brain every so often.
Right, yes.
So I was very comfortable with having the surgery and then recovering from whatever it was that I had to deal with afterwards. But my family wasn't so comfortable with my head being opened up and all those things happening. How do we have this discussion with the loved ones of people going through speech therapy so that we can give the person recovering the space they need to heal or to recover their speech?
Absolutely. No, it's a great question. And I was just, in preparation for our session, I was just brushing up on I was just having a look at some of the recent or the latest research and seeing, so I've got a review here from March 2018 to just see what the latest research was showing. And one of the therapy strategies was communication partner therapy, basically. So that is really something that we've probably always done in this field, is recognise if you're giving somebody a communication board, this is at one level, the person who you're talking to has to understand it's going to take quite a long time for you to point out the letters and get the message together that you're wanting to express, and then given the time and the space to take your time, the time that you need to get that message out. And the way to achieve that is by training the communication partners that what is required to use these alternative and augmentative strategies. But it's bigger than that. It's exactly as you've described. You probably need everybody to be on board right from the start. And so I think that one of the other strategies that in the research that they said was quite beneficial was counselling. And it could be relationship counselling. It might be counselling the whole family. So it might be something that's done by the speech pathologist, but it might be something more broad-based, because having a stroke might affect much more than your communication. The person may no longer be able to work. They might have a different role in the family. So communication is one element of all of that. But exactly what you said is so important, that everybody else is probably panicking because maybe they thought you were going to be no longer with them, and they're relieved that you're still alive, but now you're not the person that you were before, and how long is it going to take to get better, and are you going to get better? There's a lot of unknowns for people, and yeah, I can see what you say about you're thinking, calm down, everybody. I've got this, or I'm doing my best here. And I suppose it's a lot of education for people to really understand this whole process. In fact, a friend of mine who had a stroke recently, and she amazingly recovered fully within a couple of weeks. And I was talking to her about it, and she kept saying, "Oh, I'm really so tired." And I said to her, So you've had this huge insult to your brain and you're probably going to be tired for a really long time. And she said nobody had mentioned that to her. So sometimes it's just the simple things that maybe if she did, it was mentioned, she hadn't processed it at the time. Maybe you need to hear these things a few times, and maybe the family members might need to hear them a few times too if everybody's in a bit of a state of shock or having a difficult time at the beginning. It might be necessary for the clinical team or the counsellors or whoever to go through this with people a few times. And I don't know these days whether in rehab there's the opportunity for that. I think they've really tightened up with timings.
Yeah.
What have you done?
There's two things. You actually nailed it there, is that I was told things and thought I was never told. So it was really good when there was somebody around to be able to reiterate what was said and to say, oh, we spoke about that. This is what they said. This is what you need to remember, or this is what I've remembered so that you don't have to, etc. So there was that. And then there's also the very big gap between what happens when you're in hospital and what happens when you go home.
Right.
So the biggest challenge for me, I found, was in hospital they have other priorities. Their priorities are to get you healed, to be well enough to go home.
Yeah.
In the very broad sort of, expectation.
Physical health.
Yeah.
Yep.
So they achieve that really, really well, and then you go home and you have your outpatient appointments. And my outpatient appointments were 1, 2, 3, 4 a week for months. And just getting to them and remembering when they were, remembering what you have to do there, which one you're at now, and what you're supposed to do there, is difficult for most people. And then it's even harder for when you're going through stroke. And then at the same time, you get there, and as soon as you get there, it's kind of like, right, let's get in. We've got an hour. We've got this. This is our window. This is how much we have to do, and we want to give you as much as we can. And then you're out, and you're gone, and you're gone home. So it's a very whirlwind kind of scenario and environment, and that's why the gap exists, because we need things explained many times, and we need constant effort and support and tasks, to help us recover, etc., all the time, but we don't get it. And in that time, if we haven't got somebody who is, for example, recording our speech from the beginning to show us what it was like, 3 months earlier when we've gone down the path, often you forget how far you've come. So I never had the foresight to tell somebody to record the way I was walking at the beginning and how I walked at the end, or how I talked, and etc. But if there's some people who are listening, a good way to comfort the people who are going through the stroke and trying to gain their recovery and to get their speech back is to record them speaking and to show them this is how far you've come. Now that also helps the person who is caring for that person, because they actually get to see that there has been progress, even though it's frustrating. We're actually a lot further along than we used to. And the only person who really told me how far along I'd come was my psychologist, who used to see once a month.
Interesting.
And she would say, wow, you're actually putting sentences together now. She would say, you've come a long way, and we're communicating, we're having a different conversation than last time. And that was really heartening to be able to hear her actually notice the difference. That was kind of like, oh, wow, all right, somebody's actually noticed. The people I'm around all day, every day, they don't notice.
Yeah. Yes, I think this is where some of the support groups and the external groups of family members and other people, it's probably helpful to have those sort of supports. And I can't say I know too much about them, but I know when I used to work in a hospital, we would have like a stroke group of stroke survivors who'd come together, and sometimes it was a bit social. There might have been a bit of a therapy activity as well, or therapy and then a cup of tea together or something. So, yeah, that's probably another avenue for getting that type of support. Yeah, so in terms of getting the assessment or the evaluation for your AAC, it should be a conversation started with your primary speech pathologist. What we do find, though, sometimes is that people might come back 2 or 3 or 5 years post-stroke and say, now I'm ready to look at an AAC strategy. And for whatever reason, sometimes they might say, I wasn't offered this before, but it might be the same thing that you said. It might have been offered, but you weren't hearing it, or there were so many other things going on, you weren't aware of the importance of it or really what it even was. So it's interesting that people do come back at various times, and you may even, 5 years post-stroke, if you've still got some residual problems, you may not have a primary speech pathologist anymore. You might need to start that relationship again. And there are community-based speech pathologists. There are Speech Pathology Australia is the peak body for speech pathologists, and there's a Find a Speech Pathologist part on the website of Speech Pathology Australia. So if you didn't have a relationship with speech pathologist, then you'd probably use one of those avenues to find somebody. If you were still having some kind of annual reviews or something like that with your hospital or rehab centre, you could ask then to say, I'd really like to look at some alternative communication strategies now. What do I do? Where do I go?
Yeah. Well, it's been really informative. Tell me, I know that you're doing a little bit of work with a partner in the UK or in Scotland. Is that right?
Oh, yes. Talking mats. Is that what you're thinking of?
Yeah. Tell me a little bit about that.
Yeah, talking mats is really relevant for people who've had a stroke. So talking mats, yes, so we are the Australian partners of talking mats, and talking mats is a strategy for having a conversation. It's a way of structuring a conversation. So it's not particularly for people who've had a stroke. It can be used actually with anybody. It was originally designed for people with disabilities. So it's designed to make communication easier, but it's also designed to make difficult communication situations easier. So, for example, in my team, we actually use it for our staff reviews. So you don't have to have a communication problem to use it, but if you do, it's a great strategy. So it is just a mat and picture cards. And then there's a structure around the conversation. And the idea is to really give the two people having the conversation are the thinker and the listener. So the thinker is the person who's had a stroke. So it really does give them a good chance to think about a topic and express themselves through this framework. And the other person, we used to call the other person the interviewer, but that was changed and we now call them the listener, because our role really is to be a facilitator and really just to use the structure, which involves open-ended questions, so that the person really has a lot of time and space to express their own view about the topic. So the topics can be almost anything, but you start with a question. So it might be, how are you going with things at home now? So that might be a self-help topic. So it might be, how's it going with your dressing yourself? How's it going with cleaning your teeth? How's it going with talking on the phone? Whatever, that might be the topic. And so the person really gets a lot of opportunity to think about very specific points. And what people say when they go through this framework is often that they hadn't had the chance to think about those things in such detail before, and nobody ever thought, oh, sorry, the dog's gone off.
That's all right.
nobody's ever thought to ask them those questions before. You've got the visual prompts, which really helps keep you on track and give you just the visual prompt to focus. It's a great framework and a great strategy. So it does. It's ideal if people can do the training to learn how to implement it. It's one of those things. I guess it's like, driving a car and water skiing and all those things. They look really easy, and you think, oh, anybody can do that. But there's actually a lot of strategy behind it, and it's evidence-based, which is what appeals to a lot of the clinicians who use it, who like to use evidence-based strategies. So the research in all the categories, and stroke is one of them, shows that people produce more information and better quality information using this framework. And so one of the examples of how it might be used, like that self-help idea, you could actually do the talking mat with the person who's had the stroke and also with a family member, and then you get a comparison. So you can say, I'm doing okay with cleaning my teeth. I'm doing okay with, I'm not doing so well with getting up the stairs or whatever the things are. And then you do the same mat with a family member, and then you can say, actually, we need to discuss a few things here because, I thought you were doing okay with that, but maybe you need help. And, it opens up the discussion.
It sounds like a really gentle way to have some maybe hard conversations.
That is such a good point. I haven't heard it put that way before, but that is exactly what it is. Yeah.
That's what we need. That's what we need.
It really is. Yeah, that's a great way of putting it.
So what we'll do is we'll share with the listeners where they can find more information out about yourself and this and Matt. Is there a website that we can send people to come and have a look to find out more about you?
Yes. Well, I should declare that, I do run a business that sells the augmentative communication devices, and also we run the talking mats in Australia. But we very much have a clinical model, and we do, even though I'm a speech pathologist and in my team we have speech pathologists and occupational therapists, we always work with the primary speech pathologists, and the ultimate goal is to always find the ideal strategy for the person. There's absolutely no benefit to us or anybody for the person to have the wrong piece of equipment or the wrong strategy. So, we still have our code of ethics and our ethics that go with us. So, Talking Mats Australia is the Talking Mats website, and talkingmats.com is the UK site, which has a lot of the published articles and background information. So either of those are good links for the talking mats. The assistive technology that my company is Zytec, Zyteq, zytec.com.au. There are in Melbourne and most states, there are assistive technology services which are sort of more general community-based services. So the independent living centres in most states, ILC, the independent living centres would have a technology department, and the one in Melbourne is called Comtech. So, there's kind of a network of resources, and again, probably people can look those up and get a lot of information on their own, but it's still good to get your speech pathologist and or occupational therapist on board as well, mainly too because there can be funding available if you need like a device or a tool for your communication, and they will know how to help get the funding organised, and usually you do need a clinical report to say this is the appropriate device for the person. So there's a bit of a process of evaluation and trialling the device and then writing the report so that everybody's happy that it's the right thing. But if it's an iPad out of the box and you can use it, well, then go for your life. That might be all you need. And then down the track, you might not even need that.
Yeah, it's perfect. I love that you have the patient's best interests at heart. I get it. I know. I'm glad that you mentioned that you have a business and that it sells these products, etc. I know we didn't declare anything at the beginning, but that's okay. Actually, I want people to come onto the program who are able to offer a solution, even though it's a solution that has to be paid for or funded or whatever. That's perfectly fine, because I can't help people if they come to me. I don't know how to help them. I can't give them solutions and those types of things. I can only connect them with people who can help, and that's what we're doing. So it's very cool that you mentioned
very good.
where you're at. And just while we're declaring things and mentioning things, I'm not getting anything out of you, or you're not getting anything out of me, other than we're having a chat and we're just sharing. There's no commercial deal or anything like that.
Correct.
The program is downloaded all over the planet, so there is a possibility for people to be listening in and going, "Oh, where do we go if we're in the US or the UK or wherever?"
Sure.
So I know that you mentioned there was a .com. So was it talkingmats.com?
That's right, and that's for the talking mats. So the AAC, ISAC is the International Society of Alternative and Augmentative Communication. So that's international, and that's the peak body, that has representation all around the world. And there are ISAC chapters in many countries. Like, they're based out of Canada, but there would be there's a US chapter and a UK chapter, and India and a whole range of other countries would have chapters as well. And they also would have members all around the world. So that might be a good starting point to say, well, I am based in India, and what's going on in India for AAC. And there are things going on all around the world. So it's definitely a worldwide thing. It's not only English speaking. There's certainly a lot of European activity and Scandinavian activity around AAC and South Africa. Some countries that might not have as many resources, but you can always make an alphabet board on the back of a Wheaties packet. That you don't have to have fancy tools sometimes. And there's a really nice relationship with Vietnam amongst some of the speech pathologists, setting up a training school there. So these things are developing all around the world. Yeah,
awesome. So that's it. We do have plenty of ways that people can get supported. Hopefully they understand a little bit better about what challenges people face after stroke with regards to speech. Hopefully some carers are listening, and as a result of that, they can feel a little bit more relaxed and calm about a situation that seems very difficult right now, and probably is. And hopefully we've been able to connect them with somewhere to go and get some information that they can then pass on to their own speech pathologist and speech therapist, so that they can begin a conversation. And hopefully we've created a few ideas about how people can begin the journey to recovering their communication.
Absolutely. No, I think you're spot on there. It is a journey, and it can take some time, and there are a lot of resources and strategies out there. So it's just a matter sometimes of getting in the loop and finding the system and finding where the resources are. So, definitely to reach out to those organisations and just say, put me in touch with somebody in my area.
Well, Tracy, thank you so much for your time. I really appreciate you giving me an hour of your time and coming onto the podcast. And hopefully you got a lot out of it, and we can, support you just by sharing the message that you're interested in sharing just through this podcast. And I love the work that you're doing. We really, truly appreciate it.
Oh, thank you so much, Bill. It's really nice when people benefit from the strategies in the equipment as well. And you can see, people's lives changing because communication is so important to every aspect of our lives. So thank you for having me on and giving me the opportunity to share what I know.
Discover how to support your recovery after stroke. Go to recoveryafterstroke.com.